Acute rheumatic fever. Acute rheumatic fever is systemic complication of pharyngitis due to group A beta hemolytic streptococci. Affects children 2 to 3 weeks after an episode of streptococcal pharyngitis, means strep throat occur. Caused by molecular mimicry bacterial M protein resemble protein in human tissue. Diagnosis is based on Jones criteria. Evidence of prior group A beta hemolytic streptococcal infection. For example, elevated ASO or anti-DNase B titers with the presence of major and minor criteria. Minor criteria are non-specific and include fever and elevated ESR. Major criteria. Major criteria include migratory polyarthritis, phencarditis, subcutaneous nodule, erythema marginum, Sydenham chorea. Migratory polyarthritis. In migratory polyarthritis, swelling and pain in large joint, for example, wrist, knee, and ankle joint, that resolve within days and migrate to involve another large joint. Phencarditis. Phencarditis having endocarditis, myocarditis, and pericarditis. Endocarditis. In endocarditis, mitral valve is involved more commonly than the aortic valve, characterized by a small vegetation along the line of closure that lead to regurgitation. Myocarditis. Myocarditis with stopped bodies that lead to characterized by foci of chronic inflammation, reactive histiocytes with cylinder wavy nuclei, initio cell, Gantt cell, and fibrinide material. Myocarditis is most common cause of death during the acute phase. Pericarditis. Pericarditis leads to friction rub and chest pain. Subcutaneous nodule, erythema marginum. Erythema marginum is annular non-pruritic rash with erythematous border, commonly involving trunk and limb. Sydenham chorea. Sydenham chorea is rapid involuntary muscle movement. Acute attack usually resolve but may progress to chronic rheumatic heart disease. Repeat exposure to group A beta hemolytic streptococci result in relapse of acute phase and increased risk for chronic disease. Chronic rheumatic heart disease. In chronic rheumatic heart disease, valve scarring that arises as a consequence of rheumatic fever result in stenosis with a classic fish mouth appearance. Almost always in valve, the mitral valve lead to thickening of the cordia, tendini, and cusps. Occasionally in valve, the aortic valve lead to fusion of the commissures. Other valves are less commonly involved. Complications include infectious endocarditis.